Alive and Well STL is a presentation of the St. Louis Regional Health Commission with the first decade review of health status report to build a healthier St. Louis, and RareGem Productions. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
Today in studio, we have Dr. Ronnie Drake, dentist and longtime member of the Regional Health Commission Provider Services Advisory Board for the Regional Health Commission.
Your teeth are meant to last you a lifetime. Ignore your teeth and they definitely will go away. We need to eliminate a lot of the myths associated with dentistry. If you remember watching the Three Stooges or some type of comedy act, they always have someone talking about how painful a root canal is or how bad their tooth hurt and have a big rag tied around their head. And that's not dentistry.
We'll be right back.
What does it mean to you to be alive and well in St. Louis? We want to hear your story. Tell us what it means to you personally, what you need to achieve it, how our program may have helped, or even some of your best recommendations for the rest of us. You can share it on the message box at 314-333-8369. You can send an email to info@oneraregem.com. You can even post it on Facebook at ONERGP or on the Hallelujah 1600 page as well. We'll share your message with our community to help make it possible for everyone to thrive. It's great to be alive. Be alive and well, STL. 10 a.m. Mondays on Hallelujah 1600. RareGem Productions proudly presenting the positive.
What does it mean to you to be alive and well in STL?
I'm living the dream. It is simply wonderful to be able to be a part of what is going on in healthcare today. It's wonderful to be connected with wonderful people who have a vision of helping people. And I feel that this is a time for progress and new innovation in how we deliver healthcare in the city of St. Louis.
Alive and well, STL.
Good morning, St. Louis. This is Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and host of Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today in studio, we have Dr. Ronnie Drake, dentist at Horizon Medical Center and longtime member of the Regional Health Commission Provider Services Advisory Board for the Regional Health Commission. Dr. Drake, it is so great to be with you this morning.
Good morning. How are you today?
I am doing well. And you?
I am doing absolutely wonderful.
Fabulous. I believe you.
Let me start off by making a statement concerning Horizon. Horizon is not a health center, but it is a service that contracts with the state of Missouri for providing medical and dental health care to the prisoners in the state facility. We provide health care to all the state penal facilities in the state of Missouri.
Dr. Drake, I want the listeners to be able to connect with you because you are a joy to work with and to be around. So tell me more about where you were born, how were you raised, how did you come into the St. Louis community?
Oh, gosh, that's a good question there. I would say I was born in a cabbage patch, but I won't use that one as that analogy. But I was born in St. Louis, Missouri, and migrated to Mississippi and then back to St. Louis. And as a citizen in East St. Louis, eventually I moved from East St. Louis to St. Louis, and as you know, there's a very strong connection between the two cities. And one was more, I guess you might say, richer than the other city. And by living in East St. Louis, you learn to see how people are able to function with less. And in St. Louis, you saw more of an affluent type of relationship with healthcare, quality of living, and also with income. And living in East St. Louis, I was able to develop values that directed me towards wanting to help and be a part of a community.
It's a great shout out to East St. Louis. I do have an affinity for that community as well. So you became a dentist. Tell us about that journey and why dentistry out of all the careers you could have chosen.
I have to kind of laugh at that one because somebody asked me the same question yesterday. And I tell people what happened as to why I selected dentistry as a profession. and people tend to laugh and sometimes don't believe me. And it was at a time when I was trying to decide what career I wanted to go to when I was in college. And I was going back and forth between a few areas. And so one night I went to sleep, and in my dream there was a neon sign that said dentistry. And believe it or not, it might be something that was kind of quacky. When I had that vision in my dream, I decided to go into dental school. And at that time, I only wanted to go to one school and one school only, and that was to Meharry Medical College. And as a result of selecting Meharry College and selecting dentistry as a profession, I have no regrets. You know, there's a lot of times in life we would want to redo things in our life in order to do it over again. But this is one thing. If I had an opportunity to do over, I'd do it the same way. This is a wonderful profession, and I love it, and I would do it free for the rest of my life. That's the biggest problem with it. Sometimes you do it free.
That's true. What's the neon sign that you want people to know about the importance of oral health care?
There's a lot of myth associated with oral health, and unfortunately, these myths keep people from acquiring or receiving adequate dental care. And sometimes parents and adults use the dentist as a method of fear for children. They think it's a joke, but it sometimes develops into a deep source of fear that is unfounded. One thing that I think that you need to understand is that the oral cavity is more than just gums and teeth. It has a very profound effect not only on our oral capability to chew, swallow, or speak, but it also has a profound effect on our systemic problems that develop because of the fact that there are problems in the oral cavity.
Give us an example of a problem that we may not think of.
Well, one of the biggest problems that you develop as you get older, some people develop bone loss, or what we call periodontal disease. And when that happens, your teeth get loose, you have bad breath, you can't chew because your teeth are too loose and too much pain associated with it. And then you tend to move from eating healthy food to eating fast food, sugary food, poor dietary habits develop. And as a result of that, what we have now is a lot of obesity and a lot of kids and adults with diabetes, type 2 and type 1 diabetes. As you get older, we see people who are 65 years and older, and that's probably about 30% of the population are without teeth and who are either needing or with dentures. So not only does that have an impact on you, but as it relates to your cardiovascular system, there are studies that link cardiovascular disease with poor oral hygiene, and also have been shown that we have problems with low birth weight and premature birth associated with it, heart attacks, and also strokes.
And how is that all connected? So, for example, there are patients that have come across stories that I've heard of where an individual that wants to go in for heart surgery, they check first to make sure that everything is safe within their mouth. How is that connected?
If you understand that the body is just one big organism and that blood flows from every part of the body and cross over. One of the problems that people don't realize is that organism or bacteria that forms in the mouth can get into the blood system and can and will travel to the heart. If you have a weak heart valve, that bacteria can come down and settle on that heart valve and make it much weaker and develop what they call bacterial endocarditis. And that's one condition. Another condition is about having poor oral hygiene or periodontal disease or that type of infection. It can also have a profound effect on healing as relates to patients with diabetes. Any type of infection that occur at that point in time can be developing to a point where it's hard to heal. One other thing you asked me about was, I'm getting kind of old, so sometimes questions tend to fleet away from me. So if I get away from the subject, please knock on the table and then get me back online. Okay. One of the other things that I'd like to bring up is the fact that the general health of the patient is also related to implants and radiation treatment. One of the things that develop when you have radiation treatment is that your immune system is decreasing. And when you have radiation treatment to the head and neck, it's important that you have all teeth that are bad or in poor condition taken care of, because you can develop what they call radionecrosis, where this is a bone disorder that can pretty much cause you to lose part of your mandible. And implants You have to make sure that the oral cavity is in a healthy state before you do any type of implants in a patient.
And when you say oral cavity, I'm thinking that you're talking about a cavity is something that
the
I need
oral
to fill
cavity
in. So
includes not only the teeth, but it also includes the bone support and the soft tissue, the gingival tissue that is connected to the teeth.
So all of these issues and factors can come into play if we do not take good care of our mouth, our teeth, our tongue, literally our gums, everything in that area. Tell us about prevention. How can we prevent some of these things from happening?
Well, you know the old cliche, let's brush and floss every day. And that's just probably one of the best advice that we can give. Unfortunately, we have something that have been around since the 50s, and that's fluoridation of our water system. But there is a big push to have not only community-based programs, which is fluoridation, but also private-based programs, which are school sealants, where individuals go into the school, do exams on children, clean their teeth, and put a protective coat over the chewing surface of the teeth so it helps to prevent caries. That's one, and if you can't brush and floss every day, you should, after eating, rinse very vigorously in order to remove some of the food particles. What people don't realize is that it's very important to remove food particles and especially sugary products from your teeth as soon as you finish chewing them, because the bacteria that generates from them secretes an acid that forms dental caries. One other thing I like to bring up too is that see your dentist or hygienist at least twice a year.
Got to do it. And tell us about the no-nos if we have a baby, what to put in that baby bottle, what snacks to give those babies.
Oh, gosh, please don't do that. Babies are our most precious and sometimes most vulnerable product in the dental community. And people who are not well informed sometimes put a baby to bed with a bottle with sugary products in it, like a soda or orange juice. Even if they dilute it, it's still bad, because what happens when you put that bottle into a baby's mouth with that sippy cup, the cup stays there and the liquid stays there, and it's a breeding ground for bacteria and what develops called bottle caries. And when that happens, then you're looking at all the anterior or front teeth from the babies being decayed, and they have to go in and have some type of restorative process done. And a lot of times people tend to think that because these are, quote, baby teeth, they're going to go out anyway, but they still have pain. So we need to realize that with dental caries, there is, in most cases, pain associated with it.
So what should I be putting in that bottle that's safe? If I have to put something in it, what should be in it?
Maybe about $50. Put $50 bill in there, you'll be happy.
You're right, a $50 bill.
Water.
Okay.
Yes.
I think that's really good advice. The reason why we're even in the studio is because of the new report that came out from the Regional Health Commission that talks about health disparities and the trends in our region around health. What trends are you concerned about when it comes to access to dental care or oral health that we need to know about? And is there anything promising or exciting on the horizon when it comes to this topic you want to share?
Well, fortunately, there are researchers out there who are on the cutting edge of discovery as it relates to new lines of treatment related to restoring and replacing teeth. The biggest disparity that we have in this area is the fact that adults are completely neglected from our system. Children are covered through Medicaid. Adults have been eliminated from Medicaid. Medicare do not provide any type of dental service unless you are among a special group. But our biggest problem right now is finding health care for adults. Back in the 80s, when I first moved here, Medicaid was only paying for extractions. Now Medicaid, then as time went on, we went to a point where we were providing full service for adults. And in the last 2 years, they had completely eliminated adults from the Medicaid coverage. So now we are only providing Medicaid support or treatment for children. Right now, we are looking at adults who could only, if they're not paying out of their pockets or going to a federally supported clinic, they are without luck. The biggest problem is not in the major cities, but in rural areas in Missouri, where you find even less resources for them. And unless we can change the philosophy of our policymakers and find a new way of approaching the Affordable Care Act to cover dental treatments, we are facing a society where we are creating or maintaining what we call dental cripples.
So speak directly to listeners. What is the blinking neon sign that they need to see and understand and visualize that's important for them walking away from this show?
I could use a very famous cliche, but your teeth are meant to last you a lifetime. Ignore your teeth, and they definitely will go away. We need to eliminate a lot of the myths associated with dentistry. If you remember watching the Three Stooges or some type of comedy act, they always have someone talking about how painful a root canal is or how bad their tooth hurt and have a big rag tied around their head. And that's not dentistry. Most procedure in dentistry are painless and very helpful. Make sure that you go to the dentist twice a year, maintain a healthy oral cavity, and make sure that your children take advantage of these type of facilities in our area to develop a very positive approach to dental health care, because what you do to a child lasts them a lifetime. So make the first visit very positive, and if you're doing a preventive measure, all their visits would be a very positive visit.
That's great advice. So we appreciate having you, and we'll have more resources for people who are interested in knowing more about this important topic. Thank you.
You're welcome.
Alive and Well STL. Thank you for joining us today. For resources available, go to aliveandwellstl.com. If you have more questions about the program, need help, or want to connect, please call the message box at 314-333-8369. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.